Pablo, hope you're having a wonderful day. Sunday today, and most Sundays I'll be online to give a little short educational talk. And during the week, I'll try to post a webinar on a different therapy, how they work, the science behind them, and so on. I hope you caught the last one. I'll leave a link up the top here for you to click, and that'll also be linked at the end of the video because it's most important video I've ever done going into the science of high pH therapy. I think it's extremely important. Today on the website, live for 7 days only, there's a free download so you can get an ebook. You don't have to register your email or anything. We'd like you to do that so we can let you know when the webinar's on. But there's a free download. Just click on the link top of the page. Let me see, I'll find it here. I think I've got it here. It'll pop up. Here it is here. So right there in the corner, free download, just above contact us. I've put it on an angle so it stands out. It's not an error. It stands out. And there's that video there. I can't get it all in the screen, but there's the video there that I done last week. And it's a must-see on the website. I don't think anybody should miss that important video. It's also on our YouTube page, so don't forget to go to our YouTube page to see both live streams. And if you click to register on there and click the bell button, you'll get notified every time I'm uploading a video or doing a video live. And so if you really want to be educated, that's the place to be. And just some fun health tips, you'll find me on Twitter at Atlantis Health Retreat. That's enough promoting now. Let's get on to today's video, and it's very, very important. It's a summary. It's a summary of, oh, I've been diagnosed with cancer. What do I need to do? What do I need to know about? Well, firstly, relax. It's frightening and scary, so just come to grips with that. Depends on your diagnosis. Some of you maybe need to put things in order. There are a lot of people late diagnosed. So the very first tip I can say to you is, if you're not feeling well or not 100%, get to the doctor today. Don't put it off. The earlier you get on top of this thing, the quicker you're healthier and get back to normal life. So, put that there. Okay, so the number one thing, you're seeing your local doctor, you're not feeling well, he's done some blood tests, x-rays, scans, and discovered you have cancer. Getting a full list of blood tests, and number one tip, storing them. Keep a copy of everything, because you're going to see different doctors and they're going to want to review your history. So if you've had blood markers, a blood marker shows a cancer marker that may be elevated, and let's say it's a prostate marker or a breast marker, and let's say prostate, it's under 5 is possibly normal, above 5 is an issue, above 10 it may have metastasized if the marker is showing the cancer in the prostate. The breast cancers may be elevated, bone cancer, prostate cancer I've seen over 2,500, so it can go very, very high. That was an advanced case where the man had bone cancer from his neck down to his hips, and thank God the cancer actually, bone cancer we get such good success with. So okay, so number one, keep a copy of all your records. Number two, carry them with you when you see a new doctor, as well as any medication you're on. That's a tip for everybody. If you're going to see a different doctor and you're on 10 medications, take them with you so he doesn't re-prescribe something that you've forgotten to mention. And it is extremely easy in today's rush, when the doctor has 5 to 6 minutes to see you, evaluate you, and recommend something for your upset stomach or the pain that you're having in the back. And if you have those in front, he has to take the time to review them, and then he knows what you're on and he's not going to make a mistake. Very important tip. Number two, and if you're wondering what I'm doing, I'm going back, as I do every year, back to 2005, the book I wrote, and I'm going through the index, which is just a summary of what everyone should know about. I have to rewrite the book, so I'm not going to re-release it for a while. It needs to be rewritten. I've learned so many things on 23 years. You learn a lot, and so these videos they're not recorded. When I say not recorded, they're recorded and uploaded or done live, but I don't have a script written like a lot of places do. So it's just off the cuff. Um, so for women and men, thermography is a very good analysis. So it can help you find if there's any metastasis. If you're just doing general wellness checkups, thermography, which is available extensively through the US and I think England, a little in Australia, if you get a thermography done, it can find a cancer up to 10 years before any other thing can find it. It's amazing. So if you do blood tests, thermography, ultrasound as an annual checkup, harmless to your body, and there's no x-rays entering your body, you're not increasing the risk of cancer. If you do a mammogram, you're increasing your risk of cancer by 1% every time you do it. And so if you've got a sister that's diagnosed with cancer, 3% of breast cancers are possibly genetic. And so if you go and, because your sister got cancer, you go and do a mammogram every year, and then you get cancer, you go, oh, lucky I done the mammogram, but it may have caused it. So don't take a risk and do mammograms on such a regular basis. Find a female doctor, have your breast examined. An ultrasound is something you can do annually, and there's no harm to your body. I believe there's no harm to your body with that. Live blood analysis is good to see if you're nutritionally poor. When you do your blood test, do all of the electrolytes that are available, because we're finding certain minerals are low in some people with certain types of cancer, and it's not enough for me to statistically tell you this is what may be the case in your case. Just it's the cheapest part of the blood test, so no doctor's going to have an issue with adding all of the electrolytes. Okay, very, very important little thing. Then we go on to diet. What is the best diet? This is very controversial. People die because they stress about changing their diet so much. Some people don't have a problem. You tell me just to eat raw vegetables and I'll eat it. I like the eat to your blood type diet. I think that's important, especially the avoids in the list. You can download the app, eat to your blood type, also cook to your blood type. If your spouse and you are different blood types, it's extra good, because you can say, okay, I'm A, she's B, and cook that suits you. And the avoids, like I said, are the most important thing. My recommended diet hasn't changed over the years. So Monday, Wednesday, and Friday, vegetarian salads, living food. Only eat living food. And yes, you can add some tuna into those. You can add some dark fish into those. If you want to add a little bit of protein for flavor, that's fine. Quality oils only, lots and lots of oils. Those fats are fantastic for you. On Tuesday, fish. Now I say Tuesday fish because in Australia, Monday, most of the fish and chips after the weekend get new fat in. And so I say Tuesday because the fat that they're cooking is the freshest. If you're having grilled fish or however you choose to have it, that's totally up to you. But fish on Tuesday. Thursday, poultry. Some countries you need to avoid poultry if the breasts on the chickens are huge. They may have hormones in them, and I would avoid those. So you need to find free-range ducks or whatever's available in your area. And the weekend, a little bit of whatever you like. Why do I say that? Most people, when they have cancer, will stop eating sugars and high sugar foods, sweets, and so on. And that's important. Cancer is fed by sugar, and sugar increases your body's acid level, which lowers your oxygen level, which makes you tired, gives you short-term energy for long-term losses. And you just should not increase your sugar load. Your pancreas is instrumental in avoiding and winning against cancer. And if you keep having sugars, your pancreas is overworking, producing insulin to balance your sugar levels, and you do not want that organ to be exhausted. If you've got pancreatic cancer, it's a good reason. You live on takeaway food, and you're a traveler, and you're in a car a lot, and you're eating too much junk food, and the pancreas can become exhausted. Drink healthy shakes. So healthy shakes are buy greens. You can buy powdered greens. Some of them are absolutely delicious. Powdered berries and so on. Liquid nutrition is really, really good, especially some of the whole foods that are in those powders. The amino acids and the minerals in the greens, priceless and very, very important for you. When you see the doctor and he's doing your blood test, get a parasite cleanse, so urine test and a feces test. Why? Just on 50% of the people who come here have no symptoms whatsoever, but they have a urine infection, and almost everyone has parasites, which are very easily avoided with certain herbs, and or the doctor may recommend something. It's important that your body has no distractions going on, so your body's trying to keep those parasites under control, and trying to fix the infection that you're not having symptoms of. So it's okay to take some short-term antibiotics or whatever's needed to get rid of those. You want your immune system fully focused on the cancer. When you take antibiotics, we have a product called Recharge, which is pre and probiotics, gut flora. You need to take those right through the whole stage and for a week or two after. I like people with cancer have that continuously when they're on our program. Okay, so that's the basic nutrition and parasite, all to do with the absorption of food and helping your gut be healthy. One of the main things that can lead to cancer is stress, accidents, your immune system going down, but also your gut not being healthy, not absorbing the goodness. You can say, I've been taking vitamins, but you know, some doctors are correct. You're peeing it out. You're not absorbing any of that goodness. And I think that's important to understand, that your gut flora and your digestion, if it's not feeling good, it's definitely not good. And if you're feeling bloated, not well after eating a meal, then there's something in that meal that's not agreeing with you. It could be grains, it could be nuts, it could be anything. But if you're feeling bloated, start to register. Okay, I'm not going to eat this particular thing anymore because it makes me not feel good. You don't want anything distracting from your immune system when you're battling any disease. Okay, so the next thing is breathing. So the Buteyko breathing method, I used to teach that. It's a simple system, but the most important thing, if you lay on the bed and breathe, if you're breathing in and out in your chest area, it's not healthy. You need to breathe down lower in your diaphragm. So an idea of this, if you see a child get a fright, you see them breathing up high. That's adrenaline caused. But try to relax. Put your hand on your chest and on your lower stomach, and lay down and practice breathing very deep, so that you're getting all of your lungs full of oxygen. Drink healthy water. We have a specialized water system that makes it more absorbable, but it's a very controversial subject. There's so many things available on the market, and I haven't studied the up-to-date science on them. We're using the Gangan water system, and we're very happy with it. I think that's the correct name, Gangan. Eliminate potential causes, and I know if you're over 50, you may have grandchildren. You know, the young girls holding their phones next to their ovaries. Think about that. Think about that. They're walking along the beach every day doing walking. I see these health fanatics in front of our spa walking up and down, and that they've got their phone next to their ovaries. They're young girls, and they've pre-cooked their babies. Like, it doesn't make sense to me that it doesn't even register that it's not a good idea. There's definitely links between increase in brain tumors and phones, and having the phone next to your ovaries is not a good idea. You carry it, put it in your back pocket next to your bum, maybe is a good idea, because we all have phones, but I like to carry mine in my hand, and I put it down in the car, or I put it like it's on my desk. I do not put the phone close to any organs, because I think that's extremely unhealthy. Get in the sunlight on a regular basis. This is important. It can help turn off the melatonin. So melatonin is produced and helps to put you to sleep the first 3 hours of sleep from 9 o'clock onwards. If your mother told you need to go to bed, the hours before midnight are worth twice the hours after midnight, it's true. Melatonin production puts you into deep sleep, and then it's up to you to stay asleep. If you get woken up in those first 3 hours of sleep, the next day you're really, really tired. If you get woken up at 3 or 4 in the morning and then go back to sleep, it's not a problem. That melatonin goes inside every cell, tells the cell to die if it's faulty, and it may be one reason why the supplementation of melatonin in breast cancer can reduce the risk of breast cancer, and I've seen it with people with not a lot of money. It's reduced the size of their cancer just by adding melatonin. It's a very important supplement, but your body makes it if you're getting sunlight. If you're in an area that's full of snow and cold and overcast, I'm in an area that's beautiful and warm all year, but 4 to 6 months a year it's overcast. So supplementing is very, very important. You might have seen from last year to this year, we've got the farm and I've worked outside and got plenty of vitamin D. But I still take, here they are on my desk. I take, you can't see that properly, I take Balance D every day, and whether I'm in the sun or not, it's an important supplement. Exercising. Important to have a routine. So, you know, I'm talking right this moment on this video to people that are 80, 60, 50, 40, and some young ones. You all know what you're capable of, and there are some people that believe the benefits, and I will agree with this, the benefits of getting some genuine exercise in can help you feel better, but not if your core energy is too low. So Monday, Wednesday, and Friday, do some walking to a routine. It might be around the kitchen table, it might be down to the corner, it might be the full length of the local shopping center, whatever it is for you, and that'll depend on your location, what you're capable of doing, but do it to a routine. Why? If you're doing it to a routine and you find you're struggling, suddenly, out of the blue, you're not making the distance, you know something's not right. Keep a good healthy posture. Don't be slouching over. It helps your lungs, helps your spine. Very important. I spoke about eating to your blood type. Little touch on therapies and then we're done. I told you it was a short video. So again, don't forget to watch last week's long video. It was over an hour, but it's the most important one I've done, I think, in 5 years. So the therapies that we use, number one is the number one therapy in the world, because you can use it anywhere, is the GCMAF, and we sell it. We can deliver that to most places, and one vial is 60. It's more than 100 doses. It's a lot. It's a lot of doses. Probably last you over a year. But if you're advanced cancer, you would use more of it and go through it quicker. So GCMAF. Next is high pH therapy. There is nothing more powerful in a clinical environment in our facility than high pH therapy. It's my little baby. I researched for a long time. I've perfected it, and it's amazing at getting rid of fast-growing cancers and all cancers in the body. It's the reason that we've had a complete success in all bone cancers. Breast cancers, not 100%, a couple we didn't, but most breast cancers completely clear very quickly, including the lymphatic system, mouth, jaw, face, teeth, cancers, brain cancers, lung cancers if they're not completely full, if your lung's not completely full, if you get to us early, spine cancer, pancreas cancer, bladder cancer, all quick results with high pH therapy. It's got to be the best therapy on the market. Vitamin B17, along with DMSO, ozone therapy, colonic irrigation, hyperbaric oxygen, magnetic pulse, radio frequency. There's 101 different things that we have here, 101 different IV therapies, and we combine them in a way that on Monday, Wednesday, and Friday, you're doing IV in the morning and all these other therapies in the afternoon. Tuesday, Thursday, Saturday, and Sunday, you're doing just the IV therapies in the morning. And that may be 2 or 3 IVs. It can be from between 8 and 9 start and finish around 12, and then you're home for lunch. And you're relaxing those afternoons. You're doing that walk on the beautiful beach we have. It's beautiful and sunny here. I know in the US you're freezing. Time to hop on the plane and come here. It's $300 to get to our clinic most times of the year, and now's the time. That's a return ticket. It's amazing, yes? Under $500 you can go overseas. We're a short flight from Florida, and this is the place to be. So that's a quick summary, I think, of everything that I wanted to touch on. We have testimonials on the website. I will rewrite my book in the next year or two. We're busy, and there are not enough hours in the day. I'm just glancing through to see if there's anything that I... Essential fatty acids in the shake. Make sure you're making that shake. Herbal teas are good. Renee Cassie's tea is great. It also was used as a poultice, so you can put it on externally on lumps on the breast, and it may help you. I don't like to leave any of these things uncovered. I covered parasites. 100 pages in the book. I'll make sure it's 100 of mine next time. Laughter therapy is good. If you've just been diagnosed, you probably don't have anything much to laugh about, but the good thing is you have the ability to become cancer free. Don't believe the people who say you're done for, because it's not true. Every day people beat the odds, and you're going to be one of them. I believe you can do it, and you just have to choose a path, do your research, and find a coach and go with that person aggressively. We're restricted in all that I can say online these days, because they keep threatening to close down my channel. So there are certain words in that I'm not using to make sure that I'm still here to communicate to you. This is my last year, guys, and I want a 100% success rate. So I think that's covered everything in my book. I can close that now. So that's back from, I don't know, 1995 or 2005. It's an old one. So all good. So I'm going to put a little video at the end of this. Please watch it. My contact details are on the top of the website. It's early in 2023, but this video will be on for years. Don't hesitate to call. I've got some apprentices taking over, and they've been doing some training now for a year. They have to do 3 to 4 years to be able to help you 100%. So I'll be holding their hand for whatever's required. We're opening up a beautiful new facility about mid 2023. God willing, it'll be finished or close to finished. We'll be able to show you some videos. So one of the challenges is you need to book in. We need to find an apartment for you in the building above us. We don't own them, but in the new facility we will have our own private apartments for you that are beautiful, big, and then it makes it easier, because that's our biggest challenge is booking your apartment. We manage to do it, but it's nice to get directly above us. In the building above us is brand new building, and so please call early, book in. We can do scans and x-rays and ultrasound and blood tests within 24 hours of you arriving, and we get the results within 24 hours. So there's no delay here. One of the things that the most common thing people say to us is they are very impressed with how quickly we get things done. You're not waiting a week or 2 weeks to get in for a scan. We get things done really quickly. So just keep that in mind, and look forward to speaking to you on the phone. Register on the link online for a callback, or email me. The email address will be on the end of this video. You send me an email and say I'm available tonight after 7 o'clock, and I will call you. I always call the people who call early morning. I call before 12 or within 24 hours. And so until we catch up, you have a great day, and know that you do have help. We will hold your hand and make sure you do alternative therapies, the biggest combination all at once, to get the best result, to get you cancer free and get you back to normal. Usually within 3 months of arriving here, we can do that. At least then, whatever the outcome, you know that it's gone or it's not, and you've tried everything in that area, and you can consider other options. But our goal is to get rid of it in 3 months, and we'll do an assessment on you to know that we have some solid faith that we can get you cancer free and get you back to normal. So until then, God bless, have a great day, and watch this video. And don't forget, the link up in that corner is to the video I done last week. It's the most important video you'll ever see. Bye for now.
Cancer researcher, Dr. Pablo has spent years researching the research on cancer therapies. Many specialists are using one alternative therapy or another, when traditional therapies have failed. Vitamin B17 and vitamin C in high doses are common. Microphage activating factor, autoimmunotherapy is available, but not internationally. High pH therapy is exclusively available at Atlantis Health Retreat. We combine the above and more when designing your personalized program. We then add hyperbaric oxygen, detoxing and relaxation massages, and a whole lot more. The best way to explain this program is 2 plus 2 in this case equals 10 out of 10. We understand time is always of the essence, and have a philosophy to leave no stone unturned. Go to our website link below to learn more. Exclusively available at Atlantis Health Retreat.
Hi guys, just before I go, let me make sure this is connected correctly. Just before I go, I wanted to just remind you that the difference between us and other people is we throw every therapy added in our 3-month program. You might say 3 months is a long time. Well, you can come for 5 weeks and you can see that it's shrinking and then upgrade, but the results are amazing, and 3 months is what's needed. Now, some people can't travel and would like to try a few therapies, so we have what's called the Cancer Attack Pack. It's all the products you need for 3 months at home to give you a good evaluation whether it's going to work for you or not. It's not everything, but it's the best combination of things that you can do at home. It includes the shake products and a lot of powerful therapies. So don't hesitate to call and talk to us about that. Here's our contact number, my direct mobile. If you don't get me, because when I'm driving to the farm, there's a few places I may be out of range or on the phone or busy doing a webinar or consulting. So if you call the toll-free message service, they will send me an email to say that you called and I'll call you back. You can try to get me direct, but it is difficult at times. These are the webinars that are coming up over this year. I will be covering in detail high pH therapy, metastasized liver cancer, late-stage breast cancer, lymphoma, amazing results with lymphoma and bone cancer treatment, prostate cancer, breast cancer, squamous cell carcinoma, GCMEF, therapies to consider in recovery. So that's when you think the cancer's gone, what do you do? Cancer Attack Home Program, which I'm talking about shortly now, to let you know that's available. Invasive ductal carcinoma. We got a lot of women with breast cancer, and they would like individual. They've asked me to do videos for them specifically, so that's what that one is. Our Autism Program, and we're in January now, so February and March is autism months for the year. We cannot do people with autism all year at this stage until we get the bigger facility open. So you need to book in early for that, pay a deposit, and then we'll let you know the date. And we can almost give you the date at the moment, so let us know if you're interested in that. Brain cancer, when the traditional system fails, and cancer in animals. As you know, my wife owns Rescue American Native Animals, and we work a lot with animals. So I hope that's just a little thing that's important. Put the phone number at the end and the link here to contact us and register. You can register directly online, or you can call the toll-free number, and they'll make a time for me or email me to give you a call back. I always call back within an hour or the following day before 12. Have a great day.
Hello.
Hello.
How are you?
I am fine.
You look comfortable.
I am.
And you're enjoying the view behind me of the beautiful beach?
The view from this IV chair makes you want to have more IVs because it overlooks the Pacific Ocean.
Beautiful.
It is absolutely live entertainment all the time with people walking by. And because the window is a one-way window, we can see out.
But nobody can see you.
No one can see in. And there's advertising on the outside about what this company is or where we are. And so people walk up real close to it so they can read the advertisement. So you have free entertainment the whole time you're here.
Beautiful.
And you have attentive people that are here. They're bilingual. They are kind. They are well trained. And I couldn't be happier any place else on this earth to
Fantastic.
have people as concerned about my health as anyone I have ever been with. And in January, I will be 22 years from being 100 years old.
Wow, countdown.
A countdown.
Countdown. So we're having
doing a countdown.
anti-aging as well as digesting and bone strengthening. Yes, we got to get you to 100.
And I, except for right now, I'm waiting for a cataract surgery so I can see again. But this place, I don't have many wrinkles because of this place. I don't have any aches and pains because if I do, I come here and get an adjustment.
How long have you known Atlantis for?
Wow. They saved my life here 3 years ago.
Wow.
Going on 4. Soon to be 4 years when I was about a week away from dying of dehydration and other complications. And I came in here. I was taking IVs every day. This precious, precious crowd, when I went to 3 days a week that I had IVs, the nurses from here came to my house to give me shots on the day that I wasn't in here. And since then, periodically, I come back for a regular checkup.
We call it a battery recharge, yes? Recharge your batteries.
We call it a recharge. And
Keep you well.
the thing is that the IVs, the checkup IVs are custom blended for you for your own protocol. And if in fact you have headaches or you have backaches or something, all of the treatments that they prescribe for you will be for you alone.
Yeah, it's not a cookie cut system, yes.
Call it cookie cutter.
Yeah,
Okay.
cookie cut means they're
Not
the
a
same
cookie-
for everyone, and no, they're very much
No, it's
blended
not,
and
okay.
altered.
And then after, if you're very, very good and you mind and you do what you're supposed to do, then they will give you a smoothie when you're finished with your treatments, and you wait for that one. You love that one.
That's the petrol in the tank, yes.
But it's so personalized, and they care so much. If you have a loved one that is having any problems with their health, they need to be here. But if someone has a chronic disease or a really strange, wonderful, fabulous, terrible thing like cancer, don't put chemo in your body, because then you get here and then you have to take the chemo out, and that takes time. And so you're better off to get here before, when you're first diagnosed with cancer. is the very best to have a consultation with Paul and let him make an assessment of your records. And he's the most honest man I have ever known in my life.
Oh, God bless you. Thank
It
you.
is. It's true.
Thank you.
I'm old. I can say the truth. And
Yeah, I mean, I know you would tell the truth.
I would tell the truth. And
God
anyway,
bless you. Thank you. Thank you so much.
When I'm old, when people get older, they become chatty Cathys. They want to tell you all the details. And the thing about that is, I think maybe old people think that they've got another, 50,000 words that they need to say before they die. And so they'll get them all in.
Get them all in.
And I think that's why old people are chatty Cathys. But the other thing is, if in fact you are a caretaker or that you have someone in your family that has dementia or says the same things over and over again, do not correct them and say, oh, well, Mom, you said that 20 times already. Just please be kind to your loved ones if they're going through problems. Be kind to them and only say to them, I love you, Mom. Thank you for telling me that.
Yeah, I always say to people, your mom is you are going to be your mother in another few years. So what you give out, you're going to get back. So make sure you look after them extra special. Well, God bless. Thank you for coming again to Atlantis. We love to see you. And we love all the other expats to understand we're here to help. We go over and above.
That's right. And when you come here, ask for Susie and Linda, and we will come and visit. That's my sister.
And most of our guests, you've seen 90% of our guests are international, people flying from every continent on the planet, because our services are very unique and very tailored made. And again, I thank you for revisiting, and I thank you for your lovely testimonial.
Bye.
Bye for now.
Bye.
GCMAF is used for the activation of your own microphage. It is made from colostrum, mother's milk. GC is the protein name and the MAF stands for macrophage activating factor. Macrophages are found in your blood and float around and absorb all bad and faulty cells they find. They also clean up damaged and unhealthy tissue. You see evidence of them when you have a cold out of your nose or bruise yourself. The yellowing is the microphage cleaning up in that area. So our bodies are amazing, aren't they? Many things affect the production of these naturally occurring friends in the blood. Surgery, cancer, accidents, falling, parasite and viruses, vaccines, all illnesses to name a few can tax your body and cause levels to become very low. We have 14-day holiday programs to boost your body's immune system. To learn more on how to improve the frontline defense of your immune system, visit Atlantis Health Retreat, special offers.
Hi guys, just before I go, let me make sure this is connected correctly. Just before I go, I wanted to just remind you that the difference between us and other people is we throw every therapy at it in our 3-month program. You might say 3 months is a long time. Well, you can come for 5 weeks and you can see that it's shrinking and then upgrade, but the results are amazing, and 3 months is what's needed. Now, some people can't travel and would like to try a few therapies, so we have what's called the Cancer Attack Pack. It's all the products you need for 3 months at home to give you a good evaluation whether it's going to work for you or not. It's not everything, but it's the best combination of things that you can do at home. It includes the shake products and a lot of powerful therapies. So don't hesitate to call and talk to us about that. Here's our contact number, my direct mobile. If you don't get me, because when I'm driving to the farm, there's a few places I may be out of range or on the phone or busy doing a webinar or consulting. So if you call the toll-free message service, they will send me an email to say that you called and I'll call you back. You can try to get me direct, but it is difficult at times. These are the webinars that are coming up over this year I will be covering in detail.
high pH therapy, metastasized liver cancer, late stage breast cancer, lymphoma. Amazing results with lymphoma and bone cancer treatment, prostate cancer, breast cancer, squamous cell carcinoma, GCMAF, therapies to consider in recovery. So that's when you think the cancer's gone, what do you do? Cancer Attack Home Program, which I'm talking about shortly now, to let you know that's available. Invasive ductal carcinoma. We got a lot of women with breast cancer, and they would like individual. They've asked me to do videos for them specifically, so that's what that one is. Our Autism Program, and we're in January now, so February and March is autism months for the year. We cannot do people with autism all year at this stage until we get the bigger facility open. So you need to book in early for that, pay a deposit, and then we'll let you know the date. And we can almost give you the date at the moment, so let us know if you're interested in that. Brain cancer, when the traditional system fails, and cancer in animals. As you know, my wife owns Rescue American Native Animals, and we work a lot with animals. So I hope that's just a little thing that's important. Put the phone number at the end and the link here to contact us and register. You can register directly online, or you can call the toll-free number, and they'll make a time for me or email me to give you a call back. I always call back within an hour or the following day before 12. Have a great day. And